I think the problem for most of us is that nobody knows this. Consumers are completely in the dark when it comes to healthcare pricing, facility fees, what those facility fees should be. Are they rational? What the facility fees are based on, how they're calculated, which Representative Ryan asked earlier. I don't think anybody really has an answer to that question. And it would be nice to know how they're derived. In fact, the underlying hospital costs on which these fees are often based are also really opaque to consumers. Consumers rarely know what those costs are and the legitimacy of those costs. I'm not suggesting that the costs aren't legitimate, that the hospitals are putting forward. It's just that no one really has a real grasp of those services. And let me give you an example of what happens to a consumer. We had a consumer who was getting chemo treatment at a physician practice. The cost of the med was about $2,500, and the agreed-upon rate was about $400 from the carrier. During the client's treatment, the practice was acquired by a hospital. The patient knew that, but was not aware that the charges were going to change. So when the hospital acquired the practice, the charge went from $2,500 for that medication to $12,000 for that same medication every time that patient went in. And you have to ask yourself as a consumer of healthcare, what is the justification for that? Even if you argue there is overhead involved, how many times does the overhead have to get charged for it to be covered? I mean, does every time you go in, you have to get charged 10 times the amount you were charged before? So I guess my point is, we could be here for obviously hours talking about the examples that our office has seen, and it really severely impacts consumers who are left wondering what the bills are because there's such a lack of transparency around healthcare pricing, whether they have a legitimate gripe. And I applaud the hospitals for helping the people in the high deductible plans that come to them, but I would submit there are probably thousands who do not go to somebody to complain about them because they don't know that they can.